So hello everyone, this is your Krishna from Women Today YouTube channel. So in this channel, we have been interviewing many women entrepreneurs and working women across different cities in India and also across different countries in the world. So today's our guest is from Kolkata. She is an MBBS student over there, and I welcome you, ma'am. So her name is Aisha. So am I spelling it the right way, ma'am? Your name is Aisha, right?
No, my name is Isha.
Isha. Okay. So welcome,
Yeah, Isha.
welcome Isha ma'am to this Women Today YouTube channel. So please kindly introduce about yourself, about the kind of professional works that you're doing.
Yeah. Hello. I am Isha Shah from Kolkata. I live in Barashat in Kolkata, West Bengal, and I'm pursuing MBBS. I'm a third year student, and my college name is Devan Mahata Government Medical College and Hospital. So yes.
So that's a great thing, ma'am. So just one thing. So at what point of time did you decide that you wanted to pursue your studies in MBBS in medicine, ma'am?
When I was young, I was always into studies. I like studies much more than other things. So my parents decided I have to do MBBS or I have to become a doctor. Mainly my uncle, he dreamt me of becoming a doctor. So he inspired me, and from class 6, 7, I decided I will pursue this course.
I'm sure that you'll be getting a lot of success in the future. So after finishing your 5 years degree in medicine, so what kind of department specialization are you planning to take in the PG, ma'am?
Yeah, I would love to go to the surgery department as I'm really interested after seeing my seniors do the surgeries, and it really fascinates me a lot. But it's really tough. I have an option in surgery, and if it doesn't permit me, then I may go to the gynae or medicine.
Yeah, I do understand, ma'am. So also tell us, how do you actually balance both academical pressures with personal well-being? Because being an MBBS student, you must be going through a lot of pressures in going through a lot of studies. You must have studied a lot of things. So how do you actually handle the pressure between your normal life and tackling with many MBBS kind of studies, ma'am?
Yeah, that's a important question actually, because it was really different before I entered the college or MBBS life. After entering, first year has gone like it was really difficult for me to just survive. Actually, to just survive, because away from home there was no one to like handle things, and it was so difficult. Like study pressure is so much, you just can't imagine what kind of pressure we go through. Like I used to sleep for 3 hours, 3 to 4 hours maximum, and classes, extra classes, hospitals, and everything. From second year, hospital duty started, but in first year, study pressure was much more because it was the first time I'm just trying to study anatomy, biochemistry, physiology. That was really difficult to understand. Okay. Um, it was difficult. Actually, I didn't cope up easily. I used to cry a lot, and in second year, I slowly balanced things like my personal and my work thing, career thing. I balanced with time and divided time slots. That this time I'll do this time I'll do this, and sleep is very important. Whoever tells you that it's not important, I say it's really important. Like in first year, I slept for 3 hours a day. In second year, I slept 6 hours, 5 to 6 hours. You should sleep. So it improved. It slowly improved. I balanced.
So that's a great thing. So please sleep, because only because of 8 hours sleep we can just achieve anything in our life. So I tell every people who watch my interview, two things are very basic. First thing is your sleep. You should have
Mm.
8 hours of
Yeah.
sleep. Second thing is proper diet.
Yes.
That's the basic things. Other than that, if
Mm.
you even earn more crores of rupees, then it will be of no use. So these are the most
Mm.
basic things we should follow. I do understand. So also tell us, what kind of skills or knowledge do you think, because you are now pursuing what year, ma'am, and which year you are now
I'm
with
third,
medicine?
third year.
Third year. Okay.
Third
So
year.
you're in the middle of, like, you have medicine degree for 5 years. So now you're in the middle of MBBS, right?
No, medicine degree is for 4 years, like first year, second year, mean first prof, second prof, and the third final prof. Final prof has two parts. I am in the final prof first part, and fourth year is the second part. Then internship.
Okay, so it's like basically consider if you're going for a job, before that you're going to have a full-time studies. So right now you're in the full-time studies for 5 years. So I include that
Yeah.
internship in the 5 year also as a kind of studies. So right now you're in the middle of the path.
Yes.
So at this kind of stage, what kind of skills, what kind of knowledge do you think each and every MBBS student should have in order to finish their degree successfully, ma'am?
First of all, perseverance, patience. Okay. Strong-headed, serenity, and you should be very focused what you want to do in your life. Sometimes it happens ki you will have breakdowns, like hell breakdown before the exams and everything. We and our friends used to cry, like what will we do? It was so difficult. Like one paper, second paper comes, and syllabus is so vast, and we have to study that second paper between like for I have time for 6 to 8 hours and I have to study so much. How I don't know. We don't know. So you have to be very much strong headed. Then only you can survive in this field. And you should be focused. Like you should be focused very much. Ki, I have to do this, I will do this, and self motivating things will work a lot. And your parents and your loved ones should really support you in this field. Neither it will be very difficult, I think.
Yeah, I do understand. I have many of my friends in medicine who have completed medicine before many years. They are now doctors. They are now as a normal MBBS doctor. And I have many friends who are specialists in different departments like pediatric department, like anesthesia department. So yeah, that's the same words which you told. They're also telling right now. I used to ask them, how did you actually complete your medicine degree? Because when we are studying in our school days, I was a biology student, so that's why I'm able to have a lot of medicine friends, doctor friends. So at that time we'll be having a
Mm.
lot of topics to cover within a very stipulated, I mean, small period of time. In the same way, you will be having a hell lot of things to learn. It's a very massive topic because you're dealing with very many precious human lives. Of course, you have to go through it.
Mm.
You have to make yourself strong. And I always tell people that your whatever things you're focused on, please be calm at every time. Nothing will happen
Yes.
out of your control. The only thing you can do is, as you said, the very first word is perseverance. If you just keep on continuing, at
Mm.
one point of time, you will surely achieve. So please don't take that much pressure. Okay. So I just advise you to go in a very normal way. So everything will come. No need to worry. Even if there is some kind of malfunctions in our studies or any kind of practical kind of studies or theoretical studies, no need to worry. We can just go through once again. The thing is that, of course, we will be losing some time, but we should not lose our hope. We should always just keep on keeping
Yes.
it in our own hands. So actually, you have come a very long way. So you can just please continue according to your perseverance. I wish you all the best for your medicine studies in the future.
Thank you.
So also tell us, can you describe any personal growth or development you have experienced during your MBBS journey? Like right from your high school, you have gone through many things. Right now, you're in the third year of medicine degree. So, what are the changes? What are the upgradations you see in yourself at this stage, ma'am?
Firstly, um, I have been a pampered child from like beginning, but after going to the medical college, it changed me totally. I became headstrong, a lot headstrong, and I somehow are like I can handle things much more maturely than before. Then I can handle people much more than earlier. And it's very important in medical field to like read minds and to like cope up with your colleagues and your friends and your seniors. It's really important. The personal relationships or the career wise relationships with your colleagues or partners or the senior junior relationship professors are very important in a medical field because it's a teamwork, right? You should work in a team, and for that you should be able to do so, communications and your skills like um, leadership. I gained these qualities a lot than earlier.
Yeah, I do understand that communication is very important with your seniors so that you'll be having good rapport with them, get ideas from them, get some kind of knowledge from them so that you can just continue their own path and you can just achieve success. I do understand. So, also at the same time, do you have any kind of interest in any? You told that surgery is a kind of department that you wanted to do in the PG. So specifically, what kind of department? Is it like a cardiology department? Is it like an anesthesia department? Is it like a pediatrician? Because these are departments I am aware of. So please tell what are the things that you wish to do as a PG student in the future?
Yeah, my dream is like to become a neurosurgeon. Yeah, that's my dream, but it's really difficult. And I know if I want, I can achieve that. I have full belief and faith in myself. Uh, but the thing is now, it's really difficult to achieve the neurosurgery department. Like in PG, you have to do the general surgery first, then you have to do MCH, then you get the neurosurgery option. So it's a long process. It's not so much easy to handle and get, and the stress and the overall situation that would go with that in that time. I don't know how it will be, but I really hope to become a neurosurgeon.
Of course, you will become.
Until now,
Of course, you will become a successful neurosurgeon. So, neurosurgeon is something like which is related most to neurons, that is related to brain. So, what made
yeah.
you that you have, what made you, what sparked you interest that you wanted to deal with people's brain? Because that's a very complicated thing. So, also, that's the second most complicated thing, because the first most complicated thing is heart surgery. And the second most complicated thing, I think it's the surgery which deals with the brain, like neurosurgeons that you do. So tell us what made you interest in this department.
It's complicated. That's my interest.
Yeah, I do understand.
Whatever is impossible, I just want to aim that.
Yeah,
It's me.
that's a good thing to take it in a very good perspective. So you always plan to do some things which are more difficult. You actually challenge things. I do accept. So
Yeah.
hope you just get many success in the future. Like once you finish your PG, your general medicine, your general surgery, wish you all the best that you go into neurosurgeon department. Okay. And also at the same time, tell us, ma'am, can you describe any resources or support systems that have been helpful to you? Because as you said that you had more support from your family, you had more support from your senior doctors, senior students. From other than that, what are the you of course you will be having support from your friends. So other than that, what kind of support do you actually think that each and every MBBS student should have? Because as you said, it's a very complexity kind of degree. So each and everybody should have some kind of self support. So what is the most essential support that you think that each and every MBBS student should have to successfully complete the degree, ma'am?
I think first support is your seniors. It's really important, senior support. Because after entering into a medical college, you don't know anything. You are a newcomer. You don't know anything. The only person who can help you is the senior. Your senior, the dada or didi or anyone, he will or she will help you. Then comes your professors. The professors who teaches you everything should be very friendly to you and should be available. And for my part, they were available every time I needed them. My seniors, my teachers, my professors, everyone was there for me. And yeah, they supported me a lot. And for self thing, you need to now study things. Like you have to go through books, you have to go through uh, very deep. You have to go through everything before studying anything. If suppose you're studying a topic or subject and you have started studying, you're not understanding, then and there you have to ask your senior, you have to ask your professor, then you have to jot it down and note whatever you have understood, then keep studying. Like this, I have walked. Yeah, and in YouTube, I see videos. I follow. I followed Ashwini sir in first year, and in second year I took physics wala, and in third year I took Mado. So they are having very good faculties there, and they also study and help in our studies a lot. Yeah, this is my helping partners here.
Yeah, I do. Yeah, I spoke about everyone. I spoke about friends. I spoke about seniors, parents, self support, and everything. And the one thing which I missed is your professors. Yes, of course, if you do not have any kind
Mm,
of clear understanding about the clarity in your studies, you should visit your professors. And of course, if they are more support they are giving to you, then you will be shining well. I do understand. So also at the same time, in being a third year student in MBBS, so you must have gone through a lot of subjects. So what are the subjects which you feel that you are too much interested in it? Can you please explain about it?
In third year, I love the subject forensic medicine because it's really interesting and it fascinates me a lot actually. It tells about the crimes, the laws, the changes in our body after we die. Okay, then the autopsy part, which is really scary, but autopsy means the dissection of the body after death. Okay, the postmortem actually. Then what changes happens to it, then how they died, and everything. It really fascinates me
Yeah,
in third year.
that's a kind of
Actually.
thing which an each and every medical student should know about the kind of human health. So it's very important because once you go into practical sessions, then only, of course, we'll be having a lot of scared moments because we are also a normal human. When we are dealing with other humans, we'll be having a lot of panic moments. Yeah, I do accept. So also at the same time, theoretical kind of studies or practical kind of studies, what kind of studies
Mm,
do you think is very easy for you? I don't want to tell it as too much easy, but
mm.
comparatively easy. Theoretical or practical studies? Theoretical exams or practical exams? Where do you find the most comfortable zone?
Okay. Theoretical, I find practical more easier than theoretical because um, I actually it's easier for me to like show things and express myself verbally and to my professors and like I can deal with patients and I can deal with professors asking me questions and viva than theory because in theory I have to study a lot more than practicals. Because in theory I don't know what questions they will be asking me or whatever what will be coming and anything. But uh, in Viva or in the practical examination, I know and I become very confident actually a little bit. Comparatively to theory, it's better for me to give the practical exams.
So also you must have worked with many patients in college. So tell us your experience about working with many patients. You must have done some live kind of medicine duties with your patients. So tell us your experience about it, ma'am.
Yes. Okay. Once we had that we were going the male OPD, male OPD ward, male ward actually. There was a patient, a 60-year-old patient. He was diagnosed with, the professor told me, Isha, go and take history of the patient. I went and I took the history, and the patient was completely well, and the patient was not having such many symptoms and everything. Completely well, he was eating, sitting, drinking, and but he was one thing that was swelling in his neck. Okay, uh, bilateral swelling. So I palpated the swellings and everything. And then I got to know it was a case of Hodgkin's lymphoma. And I asked him what was the like it was a cancer patient and the division of the cancer is a Hodgkin's lymphoma. Okay. So I asked him and symptoms and everything, history, I took the history. And there was no history actually, nothing. He was completely fine. Only history was that he was having weight loss. Okay. So the very important Let's say if a cancer patient is weight loss, you can have no symptoms, but weight loss is the primary one that you can visibly see. Okay, so he told me when he and his son told me he was having weight loss and nothing else happened to him. And just day after day, he was just having swelling, and normal neck swellings happen due to different reasons, inflammation of the body, due to your infection, any type of infection, even in cold, even in fever, you can get the swelling in your necks, okay, lymph nodes. So in dandruff cases also you can get your swellings in the neck. So it was really difficult to diagnose the disease. So you can't like say what has been happening to us like suddenly. Just you cannot predict that weight loss can it be cancer. No doctor will just give you the tests. Just go and test for this or cancer related tests. So it's really difficult to detect a cancer patient, and so it was a late diagnosis. But I think it's better diagnosed because Hodgkin lymphoma has a very good diagnosis and prognosis. That's why the patient, it was really good. I saw that patient and it was really good experience to know that how the patients deal with such diseases.
Yeah, that's
It
a
was
good
one of my
answer. That's
experiences.
a good experience because you must have gone through a lot of case studies with different human beings.
Mm.
And of course, some studies will not be it will be actually new. As you said right now, they'll not be having any kind of medical history in the past. But because of a very small kind of things like weight loss, that's a very small sign, but it leads to a massive disease. I do understand. So also at this kind of stage, being a medical student, don't you feel scared that okay, you should have gone through a lot of studies, you should have gone through a lot of topics, symptoms regarding various diseases? So even if we get a small fever, even if we are going through a lot of small weight loss, then we'll be having a lot of scared kind of nights. What will happen that we are having these kind of symptoms? What How do you actually diagnose that okay, these symptoms are actually not related to a massive disease, these are totally our kind of
Mm.
perspective? So how each and every, what advice would you like to tell to every of your companion medical students who do actually get this kind of fearness? Okay, what happens to us if we get these kind of symptoms? So what kind of advice would you like to tell to your students, ma'am? I mean, friends.
So whatever you are telling, you're asking me is called, we gave a term for it. It's called second year syndrome. Okay. Because in second year we study pathology, microbiology, and micro we studied. So it was all related to the pathogens and the disease, how the disease grow in your body and everything. And pharmacology is the medicine part, like drugs. So here we deal with this, and during the second year time, we were like whatever happened to us, like simple fever. It was like I am having this. I just continuously think of this happened or that happened. Like it really happens, and it's normal to go through this because with very minimal knowledge and very minimal experience, it happens actually with everyone, not only me, with everyone. Every one of my friends have told me, "He see this is happening to me, Isha. I think this happened." I don't know, it's fine, and I'm going through something. I'm telling he, okay, maybe I've been diagnosed. I can be diagnosed with this, but it's not like that. So you have to be okay, and you have to be very what to say, very normal with all these things, because whatever you are studying, it's not that so easy that you will be diagnosed or will be diseased with that particular thing only, right? So it's all in your head and your presumptions and your psychological thinking. So you should deal with that. Yeah, so it's
Yeah,
nothing like that.
that's that I totally understand because as we said, everything happens according to a perspective. If we just think it in the right way, even if great situations, great kind of incidents do happen in our life, we will not fear anything. Of course, the thing is that I would like to advise people that it's not about what is happening to you. It's how you react to them 90% of your life. So being a doctor, you should have many support from anyone. And after, I think you are now in the stage where you should support your patients, telling them not to worry about anything. Even consider it may be some kind of
Yes.
deadly disease. The only thing we should do, being a doctor, I suppose I consider is make the patients calm first, because once they have the calm
Yes.
mind, everything will comes into flow. If they, even if they're not having any kind of disease, and if they're having any kind of wrong perspective, then the hormones will be released in such a way that the hormones will trigger the disease in the future. Of course, each and everything is caused by hormones, and if we don't have enough strength, if you don't have any kind of enough mental health, enough mental strength, then of course it will lead to secretion of cortisol hormones, which ultimately will lead to many kind of scary diseases. I do accept that, ma'am. So also at the same time, what do you think is the future of medicine? So you must, before you are joining medicine, you must have got a lot of information from your seniors, from your relatives, from your senior doctors, that the medicine degree was totally different when compared to 2 decades back, like in the early 2000s, the early 1990s. So now the developments in the medical industry is massive, and it's like before 2 decades, it will be like people will be going through a lot of libraries, going through a lot of practical sessions. Now everything comes in internet, in iPad. You can just view everything over there, and the
Yes.
practical
Hmm.
theories and the kind of practical and theory sessions will be totally different right now. There will be a lot of advancements in the medical industry right now. So what do you think? What are the
Yes.
changes that are, of course, most of the basic things will remain as such as it is actually, but there must be some kind of
Hmm.
changes when compared to before 2 decades back and now after 20 years now, right now. So what are the changes in the medicine degree that has happened? Is the changes, has it made it the medicine industry too much difficult to study, or is it like okay, it's comparatively it's okay, less compared to the past? So tell us about it, ma'am.
Medical industry has advanced a lot actually. We, you know, it will advance more because AI has entered the market, and then the most new thing is the laparoscopic surgeries that has helped the doctors a lot. Okay, to just do the difficult and the most complicated surgeries in very precise way, and the patient also go through the surgeries, and there is painful and scarless surgeries happen in a laparoscopy part. So this is one of the very good advantages, and there is also many disadvantages too, because nowadays we study from laptop, we study from the internet. Okay, and there is a hell lot wrong things written in the internet. Okay, people, the normal patients or the normal people, they just Google, okay, a disease happened to him or her, or something symptoms happen. Nothing. Before coming to the doctor, they just Google it, or they go to the internet and search it. What happened? But the thing is that they give a diagnosis. There's something, give the remedies that is completely bogus and wrong. Not completely, but most of the time you don't know what most important thing is the adverse reactions in a medical field. What will happen after you eat, after you drink, after you take the medicines, after you do something? That is not written there. And you can't just engulf, or you just can't eat anything, or you just can't do anything regarding your health before consulting a doctor. So this is a very, I think, is very like underrated, neglected part of the medical system that should be, I think, should be noticed. Okay, and many good things are also there. As I said, that advances like AI, and the doctors are like getting like help from the internet, and getting help from the machines that has been invent right now. Many things, equipments are advanced right now. So that's very good. But these are there are many bad things also that I think should be noticed.
Yeah, that's not only in many, that's a common kind of thing. Even before we can go to a doctor and analyze what are the symptoms we are having, what kind of disease we are having, we have some kind of curiosity. We just Google it. We just Google our symptoms and just
You
go
said
through.
no one thing. I'm interrupting. You said one thing ki, before coming, before like diagnosed with a disease, it's very important ki you should have a mindset of calmness, right? Cool headedness,
That's
and
what I
you
was also
should
telling.
uh, yes, it's my thinking too. It's very important, and a doctor should always always make sure ki you are you are not worried about your worried about your disease, because when you get worried and when you are getting tense about your disease, it's really difficult for a doctor to treat you. Okay, all things come from your mind. When your mind is calm and your mind is stable, then your body can heal. Everything comes from your mind. So it's the motive of a doctor ki your mind should be stable and your mind should not know ki what's going through your body. Your mind should be always like, I'm be okay, I'll be fine. And that should be motivating all the time. Medicines work later, your mind works first. So that's very important. And when we do the Google and the negative sides of this new AI part, so that makes you more anxious and more stressful, and that's difficult for the patient and doctors too to handle the situation. So I think that's a major part that should be dealt more delicately and should be noticed.
Of course, that's the greatest message which we had from this interview. Actually, the core of the interview has come with this one single answer which you have given. So it's very good because most of the people, before they're going to doctors, they'll be googling through a lot of things. They'll be googling and verifying with the symptoms, and they'll be having a lot of tense in the mind. Of course, whatever you said right now, calm, be calm, whatever happens in your life, because the medicine will come the secondary part to save your life, but the very first part is be calm. Of course, we cannot be calm. The thing is that we should try to find ways which will keep us calm. I can tell that whatever, if you want to go to talk to your friend, if it makes you calm, go talk to your friend. Once you remain in the calm situation, then I think it's a better situation to deal with doctors. They'll also be easy to just go through you. Of course, even a tensed patient can't get into the frequency with the doctor. They can't able to
Yes.
converse with the doctor properly, and they can't express their heart out. But once they are calm, they'll be expressing it in the right way, what happened in their life, and doctor will be able to analyze it, what actually had happened. I do understand it, ma'am. Currently, can you hear me, ma'am?
Yes, yes, I can. Suddenly something happened. I think
Yeah,
internet
there is a
connection
glitch in the
lost.
Wi-Fi again started. Okay, no problem, ma'am. One final question for this interview. So, via this interview, if you wanted to tell any kind of message to the society, what kind of message would you like to tell to the society, ma'am?
Social thing. Okay. Um, a most important message that I want to give to the society is trust the medical system and trust us. We are here. We are struggling a lot. We are we give our whole life to the people, common people, right? And trust us that we are standing by you, with you, to heal you. And we will never do anything that may harm you. Okay, just trust us. That trust has gone. I think that medical profession, with many incidences you know very well, has little impacted the medical system and the communication between the patients and the trust and the patient and the doctor. uh, that should be fulfilled. You have to trust your doctors. You have to trust the medical system because it's your life. And where you are not trusting, you can't heal. So you have to you have to trust. You have to give your whole thing to your doctor and trust that doctor will heal you. That's it.
Yeah, that's the good message, because whatever things we are doing, consider a student is studying for exam. He should have trust that he can finish the exam, he can succeed the exam. Only then he can clear the exam. If a driver is driving a car, a flight, if a pilot is going to fly a flight, then he should have a strong mindset that he can do. If of course a pilot should have some kind of trust with the mechanical engineers who are working in the ground. If they should have, if they are not having any kind of confidence with the mechanical engineers, with the ground support, then they will be, even in the flying time, they will be thinking like, okay, they have maintained the aircraft work properly or not. If they're having a lot of kind of doubts, then they will not be able to fly the plane. So in the same way,
Yes.
when a patient is coming to a doctor, when a student is coming to a teacher, when anybody is coming to the seniors, they should have some kind of trust. Only with the help of trust, each and everything, each and every atom, each and every life happens in this world. I do accept. That's once again a great message from you, ma'am. So people who are watching this interview right now, please do subscribe our Women Today YouTube channel. Please do click on the bell icon so that you can receive notifications whenever I post new videos regarding new women entrepreneurs and working women across different cities in India and also across different countries in the world. So today's our guest is from Kolkata, an MBBS student, and her name is EISHA. So thank you once again, EISHA ma'am, for joining this Women Today YouTube channel. So once again, have a good day, ma'am.
Thank you.
Thank you, ma'am.